Welcome to the show, everyone. If you are dealing with chronic pain, if you are finding that your pain medication is becoming too much, if you've been on opiates for years and years and years, and as one of our friends here and addiction counselors, Dr. Dawn Slesser, is fond of saying, you're sick and tired of feeling sick and tired? Well, this show is for you. Welcome to Living Clean, Living Well, everyone. And tonight our guest from Freedom from Addiction, Dr. Kumar Gupta, who is the medical team leader. Welcome, Dr. Gupta.
Thanks, Teresa.
And Daniel Kahn is returning to the show. Daniel, great to see you.
Hi again.
Addictions counselor. Daniel is also at working with Freedom from Addiction. So gentlemen, we've been meaning to do this show for a while, and thank you so much for coming in to talk about it. We've been listening to you. You folks have called in so many times and let us know through various other ways, email and on Facebook, that pain management is really something that you would like to talk about, that you want to know about. But as always, we're always here for your general questions and inquiries. If you're struggling, if you need help, you don't have to be on topic. All you have to be is sincere. Give us a phone call and we would love to talk to you. Tonight our topic is pain management, prescription problems with people, trying to get off opiates and things like that. And Dr. Gupta has been doing some amazing work at Freedom from Addiction, and we'd like to talk to him about it, and Daniel as well in the counseling end. So, Dr. Gupta, tell us a little bit about your work and how you got into addictions. Let's start off there.
Well, when I went through medical school, I didn't realize that addiction would be my field. I never even thought that would be close to what I was doing, but I think I got interested in it because I saw how so many people got better, and how devastating the disease actually is, and how many lives it actually affects. So I slowly got more interested in it, and then I did my training in addiction almost over a decade ago, and my focus has been addiction, helping people recover from prescription opioid addiction or alcoholism, and be what it is. We have every sort of addiction at Freedom from Addiction, so. Yeah. But prescription opiates is a big one.
Big one,
It's
absolutely.
a big one.
I want to get into the details of what the services are that you provide at Freedom from Addiction, because they've had a really good success rate. And I know there's a lot of people out there that are looking for answers. Before we go there, Daniel, I'd love if you could just share a little bit of your story, how you got into the area of addictions counseling.
I'm in my own recovery as well, so that's what brought me to this sector. And I found that what I was doing in previous life just wasn't satisfying anymore, and I really wanted to support and help others, and went back to school, got my addictions counseling education, did some trauma education as well. I'm kind of biased towards trauma work, and loving what I do now, so I'm very happy to be helping others and helping myself at the same time.
Awesome.
Yeah.
I'm curious as to why there is such a big prescription drug problem. Dr. Gupta, what are your thoughts on that?
I think the problem lies in the fact that physicians aren't trained properly in treating pain. So when you go through medical school, you learn about the diseases, but there's not really a big emphasis on pain management. So I think what happens is when you're out there in the community and then you have a patient suddenly in a lot of pain, as physicians, we want to help people, right? We want to take away the pain.
Yeah, you don't want to see anybody in pain.
We don't want to see anyone in pain. But the problem is that we're not trained in how to stop the pain medication, or often we're not really aware of how addictive these pain medications are. So it's kind of a touch-too, where the patient is needing pain medications and then the physician is struggling to sort of figure out how much does he need and when should I stop. And then it becomes a little bit more complicated. So what happens is the patient now becomes physically dependent on the painkillers. The physician kind of feels stuck, and it's a lot easier sometimes for the doctor to maintain them on the pain medication than to say, you know what, we need to start getting off them, we need to start tapering off them. We're not trained in that. And I think that unless you're an addiction specialist, you have special training in pain medication, most physicians out there are just, we're there to help people.
Yeah.
And the problem is that we end up being the enabler. Physicians, God bless us as a profession, but we can be sometimes, unfortunately, the worst drug dealers. Because we are prescribing prescription medications, it goes to the community, it becomes a huge problem, and we don't know when to stop. And in fact, the biggest drug addiction problem in Ontario right now, we have an epidemic of OxyContin addiction. We have an epidemic of fentanyl addiction. So, and it's coming from doctors. And it's not because doctors are trying to, deal with this, it's because we don't know when to stop. And patients are very good, if you're an addict, at getting the medications. So suddenly they're losing their fentanyl, they're losing their OxyContin. People don't lose their Ventolin puffers, people don't lose their aspirin, but somehow everyone's losing their OxyContin. We're replacing it, and we're sort of enabling that process, and then it becomes a huge problem.
Daniel, I find a lot of people that call in, they're scared of the withdrawal. What are your thoughts?
That's such a key part, and that's why we're lucky and fortunate to work from a medical perspective, a counseling perspective, an emotional perspective, all at the same time. Because it's really about, like you're saying, the person's being prescribed this for pain, and then they're on it, and they're maybe abusing it, and then as they start to taper off or come off it, either on their own or with a doctor, the pain is coming back.
Yeah.
These other pains are now starting to show up, and they don't know what to do with that. So if we can create an environment where a person is going through a change process in a more comfortable way, then the likelihood for them to continue to come off or go through some of the changes and gaining the ability to get to some of their goals, that's really what we're trying to accomplish from a different perspective.
Yeah.
So we're very lucky to have someone like yourself on our team to kind of look at it from a medical perspective with everything else that we're trying to do.
I had a chance to go into Freedom from Addiction and take a tour, a marvelous facility. It was just great. And you and I sat down and we talked, and I understand that you have a specific protocol that you follow, and you've had good success, haven't you, Dr. Gupta?
Yeah, I mean,
What do you do?
Like Daniel said, so it's frightening. So when patients are addicted to opiates, it's a physical dependency. It's a brain disease. Your brain changes. So it becomes a physical phenomena, and it's a very, very uncomfortable feeling to get off opiates. So we have a nice little protocol where we detoxify comfortably, and we believe in comfortable detoxes where people don't have to be in a lot of pain to get off their medications. And what we actually find is the biggest fear of people getting help is a fear of their pain coming back. Because the biggest reason why people get addicted is pain. It starts the process of they get on it innocently, and they then become dependent on it, and it becomes a rapid cycle into full-blown addiction. And they all have one thing in common, all the patients. They're all nice, they're wonderful people, they grew up in nice households with good morals. Nobody entered our facility planning to become an addict. And what happened was they unfortunately had a pain syndrome that led them to a doctor, that got them introduced to an opiate, and unfortunately, it's OxyContin is typically what's prescribed, and it's what the doctor does not tell the patient is that it is as addictive as heroin. And after even a week of using it, your brain starts becoming you become physically dependent. Not an addict, but you become dependent, and even getting off it after a week becomes uncomfortable because there's a withdrawal phenomenon as well as a physical and then a psychological dependency.
Sure. You were mentioning how you detox comfortably.
Yes.
Are you doing that medically?
We are doing that
medications?
medically with medications, and I won't get into the details of all
No,
the
that's
medications,
fine.
but I would say, and Daniel, I think you've seen the clients that you're counseling. I think they're comfortable because if we're doing it and making them uncomfortable, they're not going to engage in counseling because the whole point is to detox them and then have them engage in counseling.
Because that can be a dangerous process in itself, right?
Absolutely.
If it's not done properly.
Absolutely.
Yeah. So you've actually at Freedom from Addiction, they have these wonderful rooms that it's the actual medical center.
Yeah.
And there's nurses there.
There's 24-hour nurses.
And you're there as well.
Yeah.
Wonderful.
As a consultant.
Well, it's good that we've had this chance to discuss it. We're going to take our first break here on Living Clean, Living Well. But when we come back, as I expected, we've got a lot of phone calls. So, folks, it looks like this show is away to the races. We're going to get to those phone calls right after this break. But if you have a question tonight about addiction, about substance abuse, and specifically pain management, pain medication, opiate addiction, these gentlemen are here to talk to you. So our first break, we'll be back with your calls right after this.
It's scary to think that you're going to live the rest of your life without drugs and alcohol when it's all you've depended on. But there is hope. I knew I couldn't do it alone, and treatment allowed me the chance to ask for the help that I needed in order to believe that I could live a sober life. I got the help and support that I needed, and even now that I've left, I still have that support there.
Welcome back. Our guest tonight on Living Clean, Living Well, Dr. Kumar Gupta, who is the medical team leader at Freedom from Addiction, along with Daniel Kahn, who is an addictions counselor. Shall we go to the phone lines, gentlemen?
Let's do it.
Absolutely.
It's your turn, folks. Let's go to line one. Kate's been hanging on patiently from Stony Creek. Hello there, Kate. Welcome to our show tonight. You're first up. Go ahead.
Hi there. How's everybody today?
We're good. How are you, hun?
Good, good. I'm more or less calling about pain clinic wait times more than anything. I myself was on a pain management clinic wait list, and then a year surpassed, and my doctor's nurse called and said, "Would you like us to renew that?" And you would just go back on the wait list. And I actually opted out of that. I have upper back neck injury. And they've taken me off of all pain meds, including, like, I was only on Tylenol 3, but they took me off of that completely. My question is, what are people supposed to do during that wait frame? And I mean, so that I know a handful of people who were on a wait list for a pain clinic but couldn't get in, so they actually turned to a street drug or something to get them through. So it's just a wait thing more than anything, I found. So
Yeah.
I know that they're turning to other things.
Do you have a family doctor at all?
Oh, my family doctor?
Yeah.
I have a family doctor, yes.
And have you talked to your family doctor about, I mean, the wait time's a problem. I mean, you know, sometimes it's 3 to 6 months, but you're talking about managing your pain while you're waiting?
Right.
Is that the frustration that that's
Well,
what I'm hearing, sort of?
That's what I was talking about. Yeah, I didn't turn to street drugs, but I know a handful of folks who turned to something while they were waiting.
Because you feel there's not enough accessibility to a pain doctor who can manage their pain properly.
Correct. I myself was
Yeah.
on a wait list for 1 year, and
Right.
very recently the nurse from my doctor's office called me and said, "It's been a year. We need to renew this. Do you want to do this? Because you'll just go right back on the wait list." And I thought, no.
Yeah.
Daniel, are you hearing the same complaint from
Yeah,
people you meet with?
we hear it constantly in
Yeah.
terms of accessibility through OHIP beds or through certain public aspects. There are options, obviously, if you want to pay for them from the private sector. But like you say, I think this is something that's common and unfortunate that's out there right now. A year is a tremendous amount of time to wait, obviously, with seemingly not really an answer as to when that might come available for you. So, it's I'm grateful that you didn't turn to street in terms of that. And a lot of people absolutely do that, and I'm sure you've seen that as well.
Absolutely.
Did you have a final thought?
Pardon me?
Did you have a final thought for
Well,
Kate?
I'm thinking that maybe just talk to your family doctor again. There are many different facilities, and maybe have him refer you to more than one.
Right.
And so, if there's a waiting list in one will be shorter, and then you might get luckier and get a faster time in. So maybe look at more than one facility in your area and have them look into that.
Kate, thank you so much for calling in tonight. Let's go now to line 4. Hilda's calling in from St. Thomas. Hi there, Hilda. It's your turn on the show. Welcome to Living Clean, Living Well. Go ahead.
My question is, first of all, I'll tell you what my problem is. I have fibromyalgia and osteoarthritis. I have been put on lorazepam and oxypam for the pain. But I am to the point now when I take them, I might as well take a drink of water. What happens to a person when the body becomes used to the medication and it doesn't work anymore? Do I talk to my physician to up the medication, or do I go on Oxycontin, or what is the settlement here for the human body in this dilemma?
Dr. Gupta.
Well, I mean, you're absolutely right. I mean, if you feel it's not doing anything, then you just have the problem of just being dependent on them. And My understanding is, and I'm not going to interfere with you and your doctor, but talk to your doctor. But tranquilizers are typically not used for pain. They're used for sleep. They're used for anxiety. So they're not the medications we would typically use for pain. So you may want to talk to your doctor about maybe taking you off them slowly. The key is slowly. You've been on them for a while. And then sort of adding something while he takes you off it to something that you think may work. I mean, there's great medications out there that help pain. There's the anti-epileptics, like the gabapentins, the Lyrica. There's trigger point injections. There's a whole bunch of things they could do. But tranquilizers tend to just make people, once you're dependent on it, people actually feel better when they get off tranquilizers. They have more energy, they have more concentration, they feel better. High dose of tranquilizers can make people depressed. Fibromyalgia and depression go hand in hand. So you may want to talk to your doctor about sort of getting you tapered off that and getting onto something else while you're tapering off it.
And Daniel, from a counselor's point of view, what would you have to say to Hilda?
Yeah, I think the thing here that I'm hearing is really the tolerance that's happened internally, and I'm not exactly sure why you're on that medication, but the tolerance obviously is kicked into a point where I'm taking this and nothing's happening, which is typical with somebody who's using or abusing or being prescribed any type of medication. So not knowing exactly why you're on that medication, I'd just be careful in terms of self-prescribing at this point, saying I'm going to take more just because I'm concerned that it's not working. So I would definitely encourage you to go talk to your doctor or find a new one.
Yeah.
Now we've got a lot of phone calls to get through, but I just want a quick comment from you, Doctor, if I may. She's mentioning should I be on OxyContin or oxycodone? Your thoughts on that?
It really is an individual thing. I mean,
But that's an opiate.
It's an opiate, and we're not saying not to get on an opiate.
Yeah.
That's not the message of the day. We're saying that you have to be careful. You have to be wary if you get an opiate for pain, and you should try other options first, because the problem with opiates is that you become dependent. And it's not a short-term solution for fibromyalgia. It's a long-term solution. Yeah. And it really should be a solution of last resort. And it's still an option. So we're not here to say opiates are not helpful for some people.
Fair enough.
They are.
Okay.
Yeah.
Well done. Thank you. Thank you, Hilda. Let's go now to line 2. Ron's been holding patiently from Hamilton this evening. Hi, Ron. You've got a question for Dr. Gupta and Daniel Kahn tonight?
Well, I'd like to, but I really have some information for you all and for the community at large.
Love to hear it. Ron, go ahead.
Last week I heard some of the guests say that normally it's you have to wait 5 or 6 days in a detox, and then then you're kind of not do whatever you got to do from there. However, I found out, and I know from my own personal experience with them, the Hamilton Men's Withdrawal Management Center has gotten new funding, and they not just have the detox part of it, they also have a transitional part for men after they detox. That they can keep 7 men there until they reach treatment.
That's great.
Excellent.
Ron, say the name of the facility again, please.
It's the Hamilton Men's Detox, Hamilton Men's Withdrawal Management Center.
Yeah, I've heard of them. They're actually pretty good.
Yeah.
They're actually, they have a nice plan of action once you detox. Right, Ron?
Awesome.
Yeah, they're run by St. Joseph's Hospital.
Yeah.
Ron, I've always said that this is a forum of sharing, and thank you very much. I bet you there's a lot of people out there tonight that are thanking you. Thanks for calling in. Let's go now to Ottawa. Line 3, Gord's calling in. Hi there, Gord. Go ahead. Have you got a question or a comment for us tonight?
I have a question and a comment. Actually, I had a surgery 2 weeks ago, Monday, and when I left, I was given a prescription for Dilaudid. And as soon as I saw the name, I said, oh, why do you have to do that? Because I'm very, very leery and always have been of prescription medicine / abuse drugs. Okay. So what I did was I've been taking them, but lowering the amount that I'm taking from the prescription, and I got myself off it altogether. But in addition to that, I must say, with pain management, what I did was I knew I would have to raise my tolerance for the pain. But the good news is it's a surgery, and it will be over.
Yeah.
So.
Dr. Gupta, just before we begin, can you tell people that may not know, including myself, Dilaudid? What is it?
Well, Dilaudid is a powerful opiate,
Okay.
and it's indicated post-operatively. And if all our patients were like Gord, we wouldn't have any patients in our facility. You know, Gord has taken himself off the medications responsibly, the way you should, and tapered himself down, and should be wary. Should be wary because, you know, there is some long-term side effects to these medications. So,
Yeah.
good for you, Gord.
Yeah, Daniel, your thoughts on what
Yeah.
he had to say?
No, I think you're bang on. I think it's great that there are people out there that are aware of these types of problems, and always get concerned when I hear somebody kind of managing their own medication volumes. But in this case, it's worked out great for him, and he was aware and educated himself in terms of what was going on. So it's perfect.
Yeah, thanks for
Yeah.
sharing tonight, Gord. Let's go now to Jason. He's calling in tonight from Oshawa. Hi, Jason. You're on line 5 tonight. Thank you so much for calling in. Go ahead.
Hi there. How are you guys today?
Good, thanks.
I just want to touch base on the fear of the withdrawal. That's one of my major factors, I think, right now. I've had 5 surgeries and a fused arm ended in the end, and my main fear is the withdrawal and the sick. But I do want to get better.
Yeah.
But I know it takes time, and it's the fear factor of it with me.
Jason just nailed a point that is sort of the most powerful feature that drives addiction is fear. I mean, you become dependent on it, and you just don't want the pain to come back. Right, Jason? That's where I'm at. You're worried about getting off it. You don't want the pain to come back. You're worried about worsening pain. And you know, in our experience, actually, what happens when people are on opiates is you lose a sense of where your pain's at. So what happens is you're not sure if it's withdrawal. Are you using your prescriptions regular? Are you taking street drugs? Or are you taking a prescription like opiate?
Just a prescription
Are
opiate.
you using it properly? Do you find yourself, you know, kind of overusing occasionally and, you know, kind of waiting to see the doctor? And
Afraid to use it early because I know if you take your medication early, you run out.
right.
You could be stuck, and then you could be in a lot of
And then you
trouble
get very sick with withdrawal. So, you know, the key is what we find when we detox people off opiates is that, like what I was saying, is people lose a sense of where the pain is. They're not sure if they're in withdrawal pain, which is, you know, a body ache and worsening back pain, or is it the pain that you had that brought you onto opiates? And so what we find is when we detox people off opiates, they actually find their pain to get better, not worse. It's actually it's a paradoxical event that takes place. They actually feel better. You feel more energy. They actually find that once the withdrawal aches and pains which we treat are better, that their pain is much different. And it's, you know, quite a miracle. I mean, you can't do it on your own. You got to do it in a kind of either a supervised setting or with a good conversation with the doctor about a slow taper. The key is slow and gradual, you know, so you don't feel uncomfortable and you know what's going on. And, you know, my feeling is that you need to talk to your doctor about tapering you off and getting to where,
Yeah.
you know.
From a counselor's point of view, Daniel, when you've got somebody that's sitting on the other side of the couch from you and said, I'm just so scared about what I'm going to go through, what do you tell them?
You know, Jason, if I can, I don't know if you're still there or not, but I'm wondering if just talking about it is reducing the fear in itself.
It does actually.
Right. So that's really what I want to encourage you to do is have those conversations about what it is that you're feeling, which is this fear that you've talked about, and just talk it through. And as you've just suggested, talking about it even with us tonight or with people that you might know, family, friends, or whatever, can support you in terms of reducing some of that fear that you have in itself.
When I was in the offices of Freedom from Addiction, Dr. Gupta, you were saying that sometimes you will do the medical detox, and then they'll go through the program with Daniel and the other counselors there. But you're finding as they come off the opiates or the strong drugs, whatever they're on, that you're finding that the pain that they originally went on them for is gone. Is that what you were saying
That's
there?
what I'm saying, and I think the reason why it took them so long to get to our facility is the fear, what Jason was talking about, the fear of the pain coming back, the fear of them having to cope without any opiate. But it's amazing because, you know, pain usually over time, you know, unless you have debilitating chronic pain, can usually get better, and it's just opioid withdrawal is painful in itself. Right. And, you know, they just lose a sense, and doctors and community are not well trained at tapering off, you know, medications. You know, we have to do a better job in Ontario on training doctors.
When we hear pain, I've never
Yeah.
been through withdrawal. I just as I always say, I'm just the television host here, but for folks that may, be wondering about withdrawal, where's the pain they're going to feel? You mentioned the back or something?
Yeah, I mean, if anyone's opioid dependent, and you can verify this, I mean, it's the worst type of pain you could ever feel. It's just like a large toothache all over your body, inside and out. And when people, it's just a horrible feeling. But what happens is they're actually thinking about the feelings. And Jason, correct me if I'm wrong, but you're thinking, I'm sure you've been out of your medications earlier, and I'm sure you've had that feeling of horribleness all over your body, where, oh my God, like I can't wait till I see my doctor, it's that feeling that drives getting that prescription again and being very fearful of getting off. But that's kind of a very false sense of what's happening. That's not real. That's just a withdrawal that's there. But if you slowly taper your medications, actually, a lot of the pain actually goes away. And then you realize
the pain of the withdrawal goes away.
The pain of the withdrawal will subside if you do it comfortably. And there's ways to do it comfortably. Which you do, right? Which we do. Yeah. We give medications. We detox them with other medications, and opiate withdrawal does not have to be uncomfortable. We have a way to do it comfortably, and that's what the problem is. Because when you see opiate withdrawal, you think of the TV set of the guy puking, hiding in the bathroom and rubbing his body all over. I mean, it's horrible. But like I'm telling Jason, he doesn't have to go through that.
Okay, fair enough. Jason, I hope that gives you some hope. Folks, we have got a long lineup of people trying to get on to talk to Dr. Gupta and also Daniel Kahn this evening. We're going to take another break, but when we come back, more of your phone calls, and we're going to get to you, I promise. And folks, if you've got a question tonight, time to get on the phone, because, as I mentioned, we got lots of calls to get to. So a short break, we'll be right back.
I've been through multiple treatment centers with my addiction, fighting it for the last 10 years, 17 detoxes, 3 different treatment centers. But they put me into counseling and everything here after my detox, which was the smartest thing I could have ever done. I got the real demons out of me that I wasn't able to do over the last 10 years with all those other detoxes, all those other treatment centers, from private ones to government ones. And this place has actually given me my life back.
Hello. I'm Ellen Campbell, the CEO and founder of the Canadian Centre for Abuse Awareness. As a charity, we depend on viewers such as yourself to support the programs for First Nations, women and children, anti-bullying, and elder abuse. I invite you to visit our website, see what you can do to share. Any donation over $20 will receive a tax receipt. Thank you so much for all your support.
Welcome back to Living Clean, Living Well. My guest tonight, Dr. Kumar Gupta from Freedom from Addiction. He's head of the medical team there. And Daniel Kahn, who is an addictions counselor and also a good friend to our show. It's really great to see you gentlemen here this evening. We're talking about pain management, opiate addiction, pain prescription medication addiction. We've had a lot of phone calls in tonight. We're going to get to you. I just want to give a shout out to our friends at Recovery Wire magazine. Folks, a great magazine. You've heard me extol its virtues before. The editor-in-chief, Dee Christensen, and her team put together an excellent magazine. It's edgy, it's thought-provoking, good articles. So folks, if you'd like to get a copy, just go to their website. It's online at recoverywiremagazine.com, and we've got it up there on the line for you right now. So back to the phone calls there, gentlemen.
Let's do it.
Let's go. Line 6, Jennifer's holding from Toronto. Hi, Jennifer, it's your turn. Go ahead.
Hi. I'm calling, I have a rather complicated case. 24 years ago, I was a full-time nurse, a full-time athlete. I could go on, but I got a terrible flu, ended up in bed basically the next 24 years. I had developed fibromyalgia 2 years later. And I was put on short-acting pain medications, and I'd build a tolerance, and those didn't work. So I went to a pain clinic at Mount Sinai here in Toronto. I was put on OxyContin, and it turned out for 10 years I wasn't an abuser. I took it once, 3 times a day, but he titrated my dose from 20 up to 80 and had to stop there. One of the major complications of OxyContin and other opiates is opiate bowel, where you just, I become totally obstructed and nothing absorbs. No pain medication, laxatives, nothing works. In September, I went in to go through withdrawal off OxyContin. It hadn't worked for 4 years at all.
Wow.
My pain was 10 out of 10. And I was shocked that on the 4th day without OxyContin in my opiate receptors, I guess they were empty, my pain went from 10 out of 10 down to 5. And I've heard a lot about this drug that actually causes increased pain in the brain. Anyway,
OxyContin does.
Well, Jennifer's touching a very important point. Sometimes what happens is, as doctor, there's more pain sometimes as you increase the opiate, and doctors sort of get caught up with, and in fact, there's a lot of studies that Jennifer's, which is sort of alluding to, that suggests that going higher will not make your pain get better. And in fact, opiates only address 30% of the pain. It's not supposed to address 100% of your pain, So you brought up a very good point, Jennifer.
Yeah.
And sometimes individuals are just thinking, if they go up, that it might help. Right? And just the thought alone of having more in their system can sometimes.
But it certainly helps for the
reset.
first 3 days.
That's right.
But then after that, it's like you're back to square one, and you're actually having about a little bit more pain.
Right.
And so it's interesting how opiates work.
Jennifer, that is excellent that you brought that up and that you called in this evening. Thank you so much. The fact that the opiate, we learned something, well, at least I did, you guys knew, that an opiate can increase the pain. So thank you for that. Let's go now to line 7. Jane's calling in from Hamilton. Hi there, Jane. Go ahead. The floor is yours.
Hi.
Hi, Jane.
Hi. I just want to know if I can get a bit of help for my son.
Go ahead. Tell us what
His
you
name's
need.
Joseph Mills, and he's into crack cocaine. And I just want to get a bit of help from him if I can.
So are you looking for places to take him or people to reach out to? What sort of help are you thinking?
Like for a rehab,
Rehab, okay. Well, the sponsor of this show is Freedom from Addiction. They are located in Aurora, Ontario. We have their information up on the screen. Dr. Gupta, are there other places that you could suggest that maybe if somebody can't afford it and the beds that are available?
There's many detoxes. I think the first step is detox. And, often these detoxes will keep people for up to 2 to 3 weeks.
Yep.
And then they have places like transitional places you can go to, which are dry houses. So, it depends on your money situation. But if you're looking for something where the money's tight and you need something OHIP covered, the detoxes are the best place to go. There's a central detox line, and I don't have the number, but you can actually, I think, call 211, and then you just ask for the central detox line, and they'll sort of give you access to all the detoxes. But that's the first step. There's many other steps, but the first step is getting him into a detox.
I guess my question, Jane, is does he want help?
Yeah, that's a very good question. Very good answer.
Jane, does he want help?
Pardon?
Does your son want help? Is he reaching out?
Okay, so as you're saying, there's lots of options out there, Freedom being one of them. So it's really, hopefully from your perspective and wanting to try to help him to really get informed as to what's out there and what's available to you, and then get him there as soon as possible.
What happens when you walk in the doors of a center like Freedom from Addiction? Maybe you could just tell people what happens.
Get a big hug.
You do?
Yeah. We like you were saying earlier, we really try to make it comfortable for somebody coming in, because going back to an earlier caller, it can be very scary.
Yeah.
Walking into a treatment center and not knowing what's about to happen to you, whether it be withdrawal symptoms or treatment or counseling, and not knowing what is going to happen. So it's about making the person feel comfortable in what's going on, assessing really where they're at, and then coming up with a treatment plan. Both medically and counseling-wise, as to where we're going to direct this person, and understanding where that person's goals are. We're going to meet them at where they're at as well.
Yeah. So when you first meet a patient, Dr. Gupta, what can you lead us through what happens there?
I don't give them a big hug. But I do.
They've already had the hug. That's good.
But it's really just assessing, really taking down the fear factor. That's where I'm there. Taking down the fear factor, making sure they know that they're going to be comfortable.
Yeah.
That's what they want to hear. And they're there to get comfortable and getting off chemicals. Remember, we're dealing with not just a behavior, we're dealing with a brain disease, which is quite serious. And your brain has changed with alcohol, with opiates, with chemicals, and it's a very frightening thing for patients to be free of these chemicals. And you have to do it in a nice, gradual, warm, like you said, nice process.
Gotcha.
Yeah.
Okay, Jane, I hope that is helpful for you. We're going to have the information up there for Freedom from Addiction. That you can call them tomorrow if you like. And Dr. Gupta mentioned dialing 211, and there should be some information there as well for you. Also, our website at abusehurts.com. Look for our little Living Clean, Living Well logo. If you click on that, if you have access to a computer, we have some resources there for you as well. Hope that helps. We've got a question in tonight from Doug from Kitchener. How long is withdrawal from opiates? How long?
Well, opiate withdrawal, there's a immediate opiate withdrawal that happens within 48 to 72 hours, and there's a sustained withdrawal. So the immediate opiate withdrawal is about, about a week. But again, it depends on the medications you're getting. So, we could shorten that. But then the sustained opiate withdrawal is just the low energy part. Right. The kind of, there's a bit of, I call it the post-flu season, where you're just tired, you're low energy, you might be a little bit more depressed, and that just takes time, and that's where the counselors come in, and that's where the big hug comes in, and where but the key part about withdrawal is always every day becomes it can never get worse. That you can only go up, you can only get better. It's not like cancer where you're trying to recover from cancer, you know the end point is not going to be good. I mean, opiate withdrawal, there is a good end point. And once we get through the immediate part.
Yeah, there's the physical withdrawal, which is what you're talking about. And then there's the emotional withdrawal of what's going on internally as well. And that's what we try to have a balancing act in terms of how we're supporting a client through that process.
Gotcha. Right. Thank you, gentlemen. Let's go now to line 1, and Elizabeth's calling in tonight from Toronto. Hey, Elizabeth, thanks for your patience tonight. Go ahead.
Hi, my question and a comment is due to pain medications. Firstly, how do they plan to legalize medical marijuana, as they call it, when it's causing mental illness amongst young people between 16 and 25? I've seen a lot of children and kids in psychosis, and they're not getting out of it. I'm not talking about the hardcore marijuana users. It's not affecting them for some reason. So I'd just like a comment on that.
Sure.
This is quite important because in society today there's a lot of young kids that are in psychosis, and they stay in psychosis for years. So what's the result of this? What's going to happen to these kids?
Elizabeth, I can't answer that question. I can say that medical marijuana came about by Health Canada approval because there was a small set of patients that were dying that have debilitating conditions like cancer, AIDS, epilepsy, where there's been benefit shown. So that's why it came about. You're absolutely right. There are many young people that are abusing marijuana that show psychosis that actually, so it's really one of those very tough, it's a tough, debatable issue. I don't think we have the time to debate it today, unfortunately, but you raised a very good point.
Yeah. It's hard to know the causation, right? You're talking about psychosis being caused by marijuana or not, and it's just so difficult. The THC levels in marijuana now are changing all the time. Marijuana is being laced with other things. People are not really understanding what they're smoking sometimes.
Right.
So it's such a wide spectrum of beliefs right now in terms of marijuana. So it's hard to answer that question.
Yeah, and Elizabeth, when everything changed at the beginning of April, we actually did a show on medical marijuana, and thank you very much for bringing that up once again. I am always listening to what you folks need, and this show came about the fact that so many people were reaching out about needing help for pain management and addiction to prescription drugs. So I'm listening once again, and in the coming months we will do another debate on that. So thank you so much, Elizabeth. Keep watching. Let's go now to line 4. Gail's on the line from Nunavut. Hello there, Gail. Thank you so much for calling in tonight. Have you got a question or a comment?
Yes, I have just a question.
Sure.
I'm wondering if Dr. Gupta has recommendations for resources for health professionals on choosing painkillers and how and when to taper off. Because obviously
So there's a big movement of the College of Physicians, which sort of regulates physicians on educating physicians on using opiates properly. There's new guidelines that came out with opiate management. So a lot of new things are happening. There's education out there for doctors, and it's a matter of the doctors accessing that education. So it's still a problem, but I think it's getting better. We're also slowly, I believe, in Ontario, getting better at detecting double doctoring, which is a big problem. And so, I think with time things will get better, but I think it's going to be a long process.
And client self-education, understanding what it is that we're putting into our bodies ourselves. Why is this doctor prescribing this or that or the other? And understanding it ourselves can be part of that. We shouldn't all defer it to the doctors as well. We need to be knowledgeable as well.
Yeah. Patient education.
Yeah. Thank you, Gail. I hope that's helpful. Let's go now to line 4. Amy's on the line from London. Hi there, Amy. You're talking to Dr. Gupta and Daniel Kahn tonight. Go ahead.
Hi there.
Hi, Amy.
I just wanted to give a bit of insight and thank you guys for helping and doing what you do in the recovery process. There was a caller that had called in, Jason, I believe, and I just wanted to give him a bit of hope. It'll be 22 months clean from opioid addiction on the 3rd of May. And the pain of withdrawals does suck, but there is hope at the end of the tunnel. And I guess the biggest thing that made me realize that life is just very important, and the life after opiate addiction is so much greater and grander in scale, and it's well worth the pain that you go through in withdrawals. And, without the support of organizations like you guys, I wouldn't be here today. And I just wanted to thank you and let Jason know that there's hope out there.
Well, Amy, that's the most, I think that's the best call we've gotten today. That gives hope to everybody out there. So thank you, Amy.
Yeah, you're the light. I mean, this is why we do this. So congratulations. You're the one doing the work. We're just here to support.
I just got goosebumps.
Yeah.
That's what makes me coming back to do the show week after week is being able to share your stories, folks, and to be able to bring in guests so that we can help. And Amy, thank you. Yeah. You were talking about hugs. Amy just gave us.
That's right. Exactly.
We're going to take a short break here on Living Clean, Living Well, but when we come back, more of your phone calls.
It's scary to think that you're going to live the rest of your life without drugs and alcohol when it's all you've depended on. But there is hope. I knew I couldn't do it alone, and treatment allowed me the chance to ask for the help that I needed in order to believe that I could live a sober life. I got the help and support that I needed, and even now that I've left, I still have that support there.
Hello, I'm Ellen Campbell, the CEO and founder of the Canadian Centre for Abuse Awareness. As a charity, we depend on viewers such as yourself to support the programs for First Nations, women and children, anti-bullying, and elder abuse. I invite you to visit our website, see what you can do to share. Any donation over $20 will receive a tax receipt. Thank you so much for all your support.
Statistics state that it is likely you know a victim of abuse. It could be a friend, a relative, a colleague. It could even be you. 1 in 3 girls and 1 in 5 boys will be sexually abused before they reach the age of 18. Please give them hope. Help us make it stop. Go to abusehurts.com and give to the Canadian Centre for Abuse Awareness.
You're watching Living Clean, Living Well, and we're talking about pain management, opiate addiction, pain medication addiction, and also your general thoughts and questions about addiction in general. The forum is open, and as we had our last caller, Amy, who was calling in, it's also a forum and where you can give others hope. So thanks to everybody that has taken part in tonight's show. My guest, Dr. Kumar Gupta, he is the medical lead at Freedom from Addiction. And Daniel Kahn is here with us as well, and he is an addictions counselor. So let's head back to the phone lines. Line 2, Ron's calling in tonight from Shelburne. Hey, Ron, thank you for your patience, but it's time for your question. Go ahead.
Yeah, I just want to commend you on your program and stuff. This is the more awareness and stuff that we get out there, the better it is for everybody. And I just want to congratulate the last caller that called in on her rehab and stuff. And I just want to tell her to, keep focused and keep going. So I just had a couple of comments and questions that I wanted to address to the panel. And first of all, it all started with me when this is just a warning to everybody, there's a lot of people that are into tattoos nowadays, and I just wanted to mention that when I was 15 years old, I got a homemade tattoo from a homemade gun, and I ended up getting Hep C from that. So just to be wary, if you are getting tattoos, make sure you go to a professional and he's using clean needles and whatnot. So anyways, I contracted Hep C when I was 15. Then later on in life, I've had some car accidents. I had some back issues and whatnot. So, I was prescribed some drugs and OxyContin and Dilaudid and whatnot. And I just wanted to say that, sure, it helps the pain, but you actually have to be careful because a lot of the times you can actually hurt yourself because you're not feeling any pain, and to just be careful of that. But anyways, so I've been prescribed OxyContin, and just getting back to the Dilaudid issue, I got addicted to Dilaudid. It was prescribed to me for pain, and just to comment on Dr. Gupta about, they were asking about what Dilaudid was. It's an opiate. Basically, what it is pharmaceutical heroin is what it is. And the thing is that I was injecting a lot of this stuff, which is even worse. But I've been clean now for over 6 months,
Great.
and I'm pulling strong. And another important thing I want to touch base on is I just want to let people know that if you do want help, you have to really want to quit yourself. So, the lady was asking about her son that was involved in crack or whatever. He really wants to have to get clean and well. So all the just want to wish him all the best with that. So just getting back to the Dilaudid and the OxyContin, another thing I just want to touch base on is I think the worst thing they ever came out with is now you can get the generic OxyContin. And I just want to say the best thing they ever came out with is this new OxyContin that you have out, which you can't crush, you can't inject. That's the best thing they could have ever come out with. Now they have this generic OxyContin that you can get, which you can crush and inject, which is very bad. I think they should take that off the market completely. So I just wanted a little bit of input on that. And also, I just had a question because, OxyContin and Dilaudid, they are, sure they help with certain things, but, there's a big addiction factor. And there was a lawsuit that was put forth against Roche Drugs, because I believe they were one of the manufacturers of OxyContin. And apparently they lost this lawsuit. So I just want to let anybody know, if you've been affected by OxyContin and it's kind of ruined your life and it set you back, there is some money there for you if you look into it. I don't have the information right now, but I just want to get it out there that, if it did mess up your life and your family, you and your family members are entitled to some monetary money for that. So
if people have access to a computer, I'm sure that they'll be able to find that out. Dr. Gupta, he was asking a question there. Go ahead.
Yeah, you're absolutely right, Ron. I don't know. I can't explain why they came up with a generic version where you can still crush, store it, and inject it. I'm at a loss for words, as you are, of why they did that. But you're right, the Oxy Neo was a step forward, and then again, there was a step backwards. So
we keep hearing everybody talking about OxyContin, and I was under the impression you couldn't get it anymore. Am I right?
No.
Obviously not. You still can.
You can get it.
And its name is OxyContin?
Yeah.
Too readily available, I would say.
Too readily available.
So Oxy Neo, they never.
No, I think Oxy Neo is still out there, but the generic has come back, the OxyContin, which is Ron is talking about. So.
And congratulations to you, Ron.
On the 6 months
as well.
Absolutely.
Thank you, Ron. Thanks for everything. Let's go now to line 5, and Myra's holding from Whitby. Hi, Myra, you're on the line today. Go ahead. Myra, it's your turn. You still there, hon? I think we've lost Myra. If you can hear me, but we can't hear you, hang on, Myra, and we'll try to get back to you. Let's go now to line 7, and Evelyn's calling in tonight from St. Catharines. Hi, Evelyn. Go ahead. Can you hear us?
Yes, Teresa. Hi.
Hi.
I just want to call in and give you some information here about an organization that's run by the nurses.
Sure.
It's called Niagara Health Partners.
Mm-hmm.
Now, I came across them in a paper, and I hired them because I was put on oxycassette in 2012, and I have an excruciating pain. So I hired them, and the doctors doesn't kick me out of the office in 8 minutes or anything like that now. I'll be going to Hamilton with one of them on Tuesday for a test and circulation. So that one, the nurse that goes with me, she works at a Mount Sinai, Princess Margaret and Jaravinsky, and she teaches. It's a great organization, and I'd like people to know that this is available.
Oh, that's great. Why don't you repeat it again, Evelyn?
It's, I got to turn the pamphlet over, Niagara Health Partners.
Wonderful. That's a great resource. Thank you so much, Evelyn. Yeah, I really appreciate when people call in, because you never know who is watching this show tonight that's going, that's what I need. That's what I need. Boy, lots and lots of phone calls tonight. We're going to take a little break from them right now. Dr. Gupta, along with your work at Freedom from Addiction and your work as an addiction specialist, you actually have another line of medical work, isn't it?
So I'm a coroner as well. So I deal with the living and I deal with the dead.
Wow.
And, it's nice to see, it's humbling because you're treating people with addiction, then you sort of see the end result of addiction, which is sometimes death. And you realize how deadly this disease is. And you see young people dying from OxyContin and fentanyl addiction all the time, discovered by their parents, or older people with prescription drugs dying and not understanding the combination effect with alcohol. And so it's a great deal of what we do as coroners is actually accidental prescription drug overdoses.
Really? Is there a lot of it?
A great deal of it. A great
That's
deal of it. I
frightening.
would say at least, it's not a statistic, but 30-40% of my cases are overdoses.
Really?
Yeah. So it's an incredible journey there and back.
Yeah. Daniel, when somebody's reaching out for help, what's the best thing that somebody could say to someone?
Well, it's just to be there.
Yeah.
I mean, sometimes just listening. It might be the first time somebody's able to listen to somebody in terms of what their experience is and what they're going through in that present moment.
Mm-hmm.
And just to be an ear and to be available to somebody and be empathetic as to the concerns that they're having is really something that can be helpful in that initial starting point, because making that first phone call, getting that first point of help is usually the hardest part. Right.
And how about for those family members that are dealing with somebody who doesn't want help?
Yeah.
What's your advice to family members?
The family has to get involved in some capacity. This is, in one way or another, this is a family disease. It impacts everybody in different ways.
Mm-hmm.
There's different processes that people could go through, interventions, but it's really up to the individual at the end of the day to want that help and seek that help. But we have to make sure when we're talking to families at Freedom, we're making sure that they understand that they're a part of this, either enabling or being a part of the addictive behaviors or the recovery. And so we're not blaming the families for anything that's going on, but we have to support them in trying to support their loved ones as well.
Yeah.
And that's a difficult thing to do.
It is very difficult.
It's a really difficult thing to do.
Mm-hmm. You know what we didn't hear a lot about tonight was fentanyl, about the horrible problems going on out there.
It
the
is
patches.
taking over the overdose rate
Is
and the
it?
death rate in Ontario. It's actually replacing OxyContin with overdose deaths lately. It's because I think the problem was once the OxyContin was sort of declining, physicians mistakenly believed that fentanyl would be a better option.
Right.
And it's the street value of fentanyl and the abuse is just enormous.
What's fentanyl used for? Sorry, Daniel, I'm
It's
just curious.
an opiate. It's an opiate.
For pain.
But it's an
And it's a
anesthetic
patch?
opiate, and it's a patch. But the problem is you can boil the patch, you can smoke it, you can inject it. So
And you don't know how much is in that patch.
You
and
don't know.
Is that how the overdoses
I think
are
that's why
happening?
they overdose, because the concentration is so different. And so
So it's like Russian roulette.
it's like Russian roulette.
Yeah.
I mean, you also see somebody who's come off these drugs, and then they
Yeah.
immediately go back to the same volume and quantity they were doing before, and the body just can't handle it.
Absolutely.
And death can come from that as well.
Wow.
Yeah.
Right.
Generic OxyContin. How long have we been seeing this, guys? When did it pop onto your radar?
I think for about 10 years now, would you say?
At least.
About a decade.
Yeah.
Yeah.
So doctors know that they can still prescribe it then?
They can still prescribe it, but I think doctors are more educated
Yes.
now that they're not using that as a first choice.
Right.
And some aren't even using it as a last choice, so yeah.
I have an elderly relative who was prescribed OxyContin back before everybody knew how addictive and how awful and debilitating it was going to be. And as I feel, you were talking right at the beginning of the show, the fact that doctors, you're not really trained with the addiction side of things and all the rest. Well, now my elderly relative isn't on OxyContin anymore, which is great.
Right.
But I noticed that the doctor was really they've been the powers that be are cracking down on the doctors, aren't they?
Yeah. I mean, there's a lot more interest in opioid prescriptions now, and I think we have to be concerned, right? So it's the physicians are more concerned. I think the colleges are more concerned too. That regulate the physicians.
The conversation has to continue.
Yeah.
More awareness through the conversation has to be heard by not only the doctors, the counselors, but also the people who are out there and understand how impactful these prescribed medications can be in someone's life, and even stuff like sitting around the shelf. We got to know what to do with that stuff, and not leave it lying around for people to use.
Yeah, the whole show's been impactful. I have learned so much, and not only from my wonderful panel tonight, but from you folks as well. Dr. Gupta, you said something right off the top of the show that really captured me as well, and it's the fact that, people that are going through these addictions due to pain and pain management, that sort of thing, they were raised in good households. They've got good morals, right? So it's okay if you've got a problem to put your hand up and say, I got a problem, right?
Right. The problem with it, the problem when you're hooked is that there's a shame factor and there's a secrecy factor, and it's a stigmatized disease. So no one is going to announce that at the dinner table.
Yeah.
And unfortunately, it becomes one of those surprises to a family, which becomes quite devastating sometimes in the impact it has on families.
Yeah. So we're going to take our final break here on Living Clean, Living Well, but when we come back, we're going to wrap this show up and have some final thoughts from Dr. Kumar Gupta and Daniel Kahn. Stay with us, folks. We will be right back after this break.
I've been through multiple treatment centers with my addiction, fighting it for the last 10 years, 17 detoxes, 3 different treatment centers.